Hello and welcome for a webinar on osteology. Today we will start a new topic, and that is general osteology. So in the study of general osteology, we will be dealing with general anatomy of the bones and cartilages. My dear friends, this topic is very important topic to understand the whole anatomy, whole human anatomy, because this is more basic, and osteology is also important for examinations. So I welcome you all once again for the first episode of general osteology. Today we are going to deal with the general introductory part of osteology. I'll be dealing with osteology in 4 to 5 episodes. So let us begin with today's topic, that is general osteology introduction. Are you ready? Yes. So before we start with the study of osteology, let us understand what is skeleton first. You can see a skeleton here, and another image of skeleton is shown here. We should know what is skeleton. Skeleton means a framework of bones and cartilages which is made for the support of body. Okay, and it includes bones and cartilages, and it is a framework made up of bones and cartilages for the purpose of supporting the body. So whole body is supported at the behest of bones and cartilages. So not only bones, even cartilages. So these two words, bones and cartilages, and framework of bones and cartilages for the support of body. So I use these 4 or 5 words to make your own definition on skeleton. Skeleton is primarily designed for a more effective production of movements with the help of attached muscles. So muscles are attached on the bones. Maximum or most of the muscles are attached on the bones. At least skeletal muscles, they are called as skeleton because they are attached to the bones, origin and insertion. They help the skeleton to produce movements with the help of nervous system, because nervous system is the highest controlling and coordinating system. Motor supply is required for the purpose of movements, and that is called as locomotion. Well, at the outset, let me tell you that amongst the animals, even in the birds and aquatic animals, even in the insects, there is a skeleton present, and it may be of either exoskeleton type or endoskeleton type. If human being had bones on the outer surface of the body, just like this costume, the person which is wearing here, if he had bones like this, it would have been exoskeleton. So this is not exoskeleton. The person is wearing a costume here, but this is endoskeleton, and human beings have got an endoskeleton, means the bones which are present inside the body, not outside the body. But there are animals, different types of animals where, which have a skeleton on the outer side of the body. And here you can see a crab which is having exoskeleton. The bones of the crab are not exactly the same like bones of mammals, but see, their covering is chitinous outer covering. So that is their skeleton. So it is called as exoskeleton. And the lower image shows you a cat, I think, and it has got it's a mammal, so it has got bones inside the body, just like human beings. So that is endoskeleton. So let us try to understand the basic difference between exoskeleton and endoskeleton through this image. Well, here there is another beetle here, and that beetle is having exoskeleton. That is a chitinous covering of this creature, and you can see a lobster like creature here who is having exoskeleton, another prawn like exoskeleton, and here is a shaded exoskeleton of that prawn as a aquatic animal. Well, this is a common animal, and this is a turtle, and it has got a covering on its body, and bony covering. So it's fibrous but quite tough. So this is exoskeleton. A typical examination of exoskeleton is called as a carapace. The turtle or tortoise, they have a carapace for their protection. This is exoskeleton. Well, here there are two animals, master and his pet, and both are mammals, human being and a dog. So both of them have got endoskeleton. So here is exoskeleton, and here you can see endoskeleton. Outside the body and inside the body. Remember, exo and endo. Okay. And endoskeleton, bones and cartilage which are present inside the body. In human beings, we have got an endoskeleton. Though we see the nail and hair, they are not bones. Those are the derivatives of skin. And the teeth are bones, but they are inside the body. Even the horns on the animals, those are not bones. Those are the derivatives of the skin. So even animals have got horns. So you can't say they have got an exoskeleton. They have got endoskeleton. Okay, we talk about a buffalo or ox. So those are derivatives of the skin. You can see a front view and a back view of a human skeleton here, and different names of the bones which are shown here. There is another image to show you that bones of human beings are present inside the body. So human beings have got an endoskeleton. Here you can see the skeleton separately shown here with different bones in the body. It's an endoskeleton. And with this, my dear friends, let us finish this in skeleton part of the study as far as the osteology is concerned. So we'll not talk more about skeleton unless and until we come for the division of skeleton later on. So before we study osteology proper, we should know about the skeleton. So that is why I have explained this some of the images I showed about animals. Let us now begin with osteology proper. Osteology means study of bones. In this image, you can see a skeleton, and the yellow color is given to the bones. So the yellow color part of this skeleton is a bony framework, whereas the yellowish color here intermittently shown mostly in the midline, this is made up of cartilages. So study of cartilages means chondrology. Chondros means cartilage. That we will study some other day. Now we will study only osteology, means study of bones. Okay. The bone has got different synonyms, and these are the scientific names of the bones. Bone is an English word, but os in Latin or osteon in Greek, these are real anatomical names. From that, we have some terms in our medical science like osteology, means study of bones, ossification is formation of bone, osteomyelitis means inflammation of bone, osteomyelitis malformation of bone, osteoma means tumor of bone, osteotomy means surgical opening of the bone. We don't call it as a bonology or bonitis. Remember that. Okay. So these are the real name, but osteon is commonly used in anatomy as well as in different medical subjects. So remember this synonym. Now, what is the definition of bone? So bone, even though it is osteon, but in a common language, we have to use this word bone. Okay. There are 4 types of basic tissues, you know those: epithelial tissue, connective tissue, muscular tissue, and nervous tissue. Out of these, connective tissue is present all throughout the body because it connects different organs and systems to make up an organism. But there are 2 specialized connective tissues: blood and bone. Blood is in liquid form and bone is in a solid form. So bone is a specialized connective tissue made up of 1/3 organic matrix impregnated with 2/3 of inorganic salts. 2/3 is organic salts, inorganic salts, and 1/3 is organic matrix, that is collagen fibers. Okay, the inorganic calcium salts which are present in the bone are mostly calcium phosphate and partly calcium carbonate, calcium phosphate and calcium carbonate, and there are traces of some other salts. These salts make bone hard and rigid, now which can afford resistance to comprehensive forces such as weight bearing and impact of jumping. So easily the bones do not get broken because of the strength provided by these various salts, inorganic salts. Now the organic part which is present in the bone is made up of collagen fibers. It's called as matrix. These collagen fibers, they make these bones tough and resilient. Resilient means flexible, which can afford resistance to tensile forces. So that is required for the requirement of the bone to have resilience. And they are not, what you call flexible like, rubber, but they are flexible if a sustained, tensile force is applied to it. In strength, actually bone is comparable to iron and steel, but iron and steel, they are not living tissue. Bone is a living tissue because even though it is hard and it has got high calcium content, it is hard and rigid. Bone is very much a living tissue. It is highly vascular and he has got a constant turnover of calcium content. It's highly vascular, and you know that bone has got a bone marrow, and the bone marrow is a factory of RBCs. Hemopoiesis continuously takes place in the red bone marrow. Bones shows characteristic pattern of growth. It is subject to disease and heals after a fracture. So bone keeps on growing. It has got a regenerative capacity. It can become sick due to some diseases. It can get broken and it heals after the fracture because of regenerative capacity. That is why bone has got greater regenerative power than any other tissue in the body except blood. So blood is highly regenerative connective tissue, and the second regeneration capacity is given to the bones. So the bones, though they look hard and rigid, they are highly living and they have got a regenerative power. Bone can mold itself according to changes of stress and strain it bears. It can mold. Long bone can become a circle if such force is applied to the bone. Gradually and eventually it becomes a ring, a long bone. So that is why this characteristic I have mentioned here, molding. If the bones are not used, they go in disuse, atrophy. And if the bones are overused, they go in hypertrophy. So either they become very big or they become small depending upon uses. So usually the sportsmen have got a strong bones because they are using their bones again and again. Okay. Well, this was general introductory part of different bones and its characteristic. Now let us go for the division of skeleton or skeletal system. The human skeleton is an endoskeleton, and it is divided into two parts: axial skeleton and appendicular skeleton. Axial comes from axis and appendicular comes from appendages. Axis means central axis of the body. The body has got one central axis in the body, and the bones which lie in and around the central axis are collectively called as axial skeleton. And the remaining bones which are present in the appendages of the body. Appendages means branches of the body. Body has got four branches in terms of four limbs, two upper limbs and two lower limbs. So bones of upper limb and bones of lower limb are called as appendicular skeleton. Well, through this picture, it is very easy to understand. The image on the left side, if you see the color brown, the brown color is given to the bones of appendicular system. And you see that those are bones present in the upper and lower limbs. And the image on the right side is opposite to that. So remaining bones are shown brown in color, brown in this image. And those bones lie in and around the central axis, and they are called as axial skeleton. So appendicular skeleton and axial skeleton. Now we have to understand how many bones are there in axial skeleton, which are those bones. Let us try to have some glimpses of appendicular and axial skeleton through this image. Same colored images are shown here. These brown colors have got different names, like in upper limb clavicle, scapulae, humerus, bones of the limbs, hand, in the lower limb, bones of the pelvis, femur, and so on. In the axial skeleton, you can see the bones of the skull, cranium, thoracic cage, ribs plus sternum, and vertebral column is also called as spine. We'll come to the names of these bones in the further through slides. Like here, let's talk first about axial skeleton. The regions of the skeleton, mainly two parts, axial and appendicular. So in axial skeleton, there are total 80 bones altogether in a body. You can see the names of the bones, and you can see the number of bones in this chart. Skull is actually having two parts, mainly two parts, that are cranium and face. And hyoid bone is below the mandible, and ear ossicles are present in the temporal bone. So you can say first we talk about cranium and face. In the face there are 8 bones altogether, and in face there are 14 bones altogether. And hyoid bone, there is only one here, and there are 3 ossicles each in the middle ear, stapes, malleus, and incus. So 3 together become 6. And in the vertebrae there are, though the vertebrae are 33 in number, last 2 parts of vertebrae, that is sacrum, is fused to make 1, and coccygeal vertebrae 4, they fuse to form 1 coccyx. So considering 1 coccyx and 1 sacrum, we get 26 number of bones. Otherwise, individual separate vertebrae are 33. In thorax, we have one sternum and 12 pairs of ribs. So 24 plus 1, 25. So altogether in the axial skeleton, we have 80 number of bones. Well, in appendicular skeleton, let us divide it into two parts, supex and infex. Supex means superior extremities and infex means inferior extremities, upper limbs and lower limbs. So in superior extremity, in the pectoral girdle, that is shoulder girdle, we have got two clavicle, one on each side, two scapulae, one on each side, two scapula, two clavicle. In the upper limb proper, two humerus, two ulna, two radius. There are 16 carpal bones, 8 in each wrist, okay? 10 metacarpals, 5 in each hand, and 20 phalanges means 14 in each hand. Altogether 64, 64. And if you consider lower limb, though it is homologous to upper limb, there is little difference between upper limb and lower limb as far as, see, the number is 62 as far as total bones are. In upper limb we have 64 bones, in lower limb we have 62, both, okay? That means in each upper limb you will get 32 and each lower limb will get 31. So in pelvic girdle there are two pelvic bones. Pelvic bones are also called as hip bones. Pelvic girdle, hip bone, and also called as coxal bone or coxa, coxa. And lower limb extremity proper, two femur, one in each, two fibula, two tibia, two patella. And instead of carpals, we have got tarsals here, and there are 7 pairs, 7 in each foot, so 14. Metatarsals, 5 in each, so metacarpals in hand, metatarsals in feet, and phalanges, same name, same number, 28. So altogether 62. And if you count this together, 80 in axial skeleton and 126 in appendicular skeleton, see 64 plus 62 is 126. And altogether there are total 206 number of bones in the body, considering 26 vertebrae. If you consider 33 vertebrae, they become 213. Okay, that depends upon how you count it. Well, now let us try to understand the individual bones and names which are present in the axial skeleton first. So I am showing you skull first, and in the skull there are actually 29 number of bones, including the hyoid bone which is present below the mandible. 29 means one hyoid bone, one mandible, and 3 ossicles in each ear. Then it becomes 29. If you talk except ossicles, except hyoid bone, they become 22, including mandible. And excluding mandible and all, we get only 21 bones in the skull. Okay, so depending upon how you explain, the answer has to be given to the examiner. How many bones are there in the skull? You have to say there are 29 bones in the skull, including hyoid bone, including mandible, and including ear ossicle. Then your answer is correct. If you say 22 bones are there in the skull, 22 bones in the skull, including mandible, excluding ossicles and excluding hyoid bone. The hyoid bone, where to count, whether to count it in the head or to count in the thorax. It is not in the thorax, it is in the neck and above the thyroid cartilage. So we have to include it in the head list. Well, now we come to the thorax. In the thorax, if you see, there are 12 pairs of ribs, 12 on each side. So 24 ribs and one bone which connects in the midline towards anterior side is a sternum. So sternum plus 24, 25 bones we get in the thorax. But the ribs are having little part of costal cartilages in front, so they are shown in bluish color. These are the cartilages, but first rib is made up of bone also, cartilage also, bone also, cartilage also. Likewise you go, except last two, all others are having cartilages. Okay, that is the bluish color shown here. And these are parts of sternum, manubrium, sternum, sternal angle, body of sternum, sternal joint, and xiphoid process, which is again in a cartilaginous point, intercostal spaces, and so on. Lots of things you study about these cartilages, costal cartilages, ribs, when you come to the osteology of thorax. Now what remains in the Axial skeleton is a spine. Spine means vertebral column. Vertebral column is made up of 33 vertebrae individually if you separate them. But it is 26 when you count sacrum as one and coccyx as one. So there are 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae, and sacrum 1 and coccyx 1 if you consider fusion, and they become 26. You can see the intervertebral disc. In the last two fusion, because of fusion, there are no intervertebral discs. Okay. Here you can see another picture of vertebral column. The red color vertebrae are cervical. They are in 7 number. Blue color are thoracic. They are in 12 number. Lumbar are shown in yellow color and they are 5 number. And green color, single bone is shown sacrum, but they are fusion of 5 sacral vertebrae. Okay. And the last one, purple, is a coccyx. It is also fusion of 4 coccygeal vertebrae. So altogether, individually, there are 33 vertebrae, but the single bone wise, there are 26 bones in the vertebral column. Here you can see again vertebral column shown in different colors with the skull portion there, and even the part of lower limb, that is hip, is also shown together here. Now let us not waste time more on axial skeleton, because that is enough to make you understand how 80 bones, how we get 80 number of bones in axial skeleton. Now let us try to understand which are the bones which are present in the appendicular skeleton. The appendicular skeleton, we have 4 limbs. So upper limbs 2 and lower limb 2. We'll talk about upper limb first. So altogether in upper limb, I told you that there are 32 number of bones in each upper limb. Altogether 64. So in the shoulder girdle, we have clavicle and scapula 1, 1, humerus 1. And in the forearm, we have got 1 ulna on the medial side and radius on the lateral side. So altogether 1, 2, 3, 4, and 5. 5 bones up to the hand. And in the hand, there are 27 bones, because there are 8 carpals, 5 metacarpals, and 14 phalanges in each hand. So 27 plus 5, 32. And 32 plus 32, 64 in upper limb. Here you can see the names of the carpal bones from lateral to medial side. If you see, first is scaphoid, lunate, triquetrum, pisiform, and from again lateral to middle side in the distal row. So there are 2 rows, proximal row and distal row. Trapezium, trapezoid, capitate, hamate. Okay, 4. And these red color bones are metacarpals. They don't have names, but they have numbers. First metacarpal, second, third, fourth, and fifth. And remaining are phalanges. The yellow color are the proximal phalanges, and the green color are the distal phalanges. And in between them, there are purple color middle phalanges. But on the first digit, there is no middle phalanx. There are only 2 phalanges. That is why we get 14. Same phalanges are shown, and same carpal bones, metacarpal bones are shown in numbering here. If you want to understand the names of different carpal bones, this is very easy through short forms. The TR, TM, and T. There are 3 T. So one is TR is triquetral, TM is trapezium, and only T is trapezoid. So it's trapezoid here. Rest of the is scaphoid, lunate, pisiform, capitate, hamate. Capitate is the biggest one, so it's capital. Hamate is just like hammer. It looks like hammer. Pisiform looks like a P. Scaphoid looks like a boat. Lunate looks like a luna, half moon. And here you can see the phalanges, proximal, middle, and distal. Okay. Now we'll talk about different bones in the lower limb. So I told you that altogether there are 62 bones in both the lower limbs. So there are 31 in each lower limb. So in the lower limb, the first bone comes is a hip bone. Hip bone is also called as pelvic bone, also coxa bone. So pelvic bone 1, femur 1, patella 1, tibia 1, fibula 1. So altogether 1, 2, 3, 4, and 5. Here you get 5 bones, and in the foot there are remaining 26. Okay, so altogether 31 in one lower limbs. 31 plus 31, 62 in both the lower limbs. Though the upper limb, lower limb are homologous to each other, there is a little difference due to erect posture in human beings. Certain things have got evolved. Now, if you go in the foot, you have a 7 tarsal bones, 7 tarsal bone in one foot. The biggest one is a calcaneus or calcaneum, other is talus, third one is a cuboid, fourth one is navicular, and 3 cuneiform, lateral, middle, and medial. Okay, and as usual we get 5 metatarsals. In hand we have metacarpus, but here we have metatarsal. They are quite, big, and 14 phalanges just like upper limb. So altogether, how many? 26 number of bones we get. Okay, 14 plus 5, 19, and 19 plus 7, 26. Well, I think this much of introduction is enough for today's episode, because we wanted to have the introduction on osteology, you know, general outline of skeleton, different parts of skeleton, and different bones which are present in the uh, total skeleton. Altogether 26 number of bones we have studied, and tomorrow we'll go with further study of osteology. And I think this is a time to end today's webinar. See, these people are running now, and we have also to run away. And with this, I'll take a break today, uh, and I request you all to come on time tomorrow morning at 10 o'clock. Thank you. Thanks a lot. Come again tomorrow. Have a nice day. Thanks.